Good morning, everyone. I would like to call this public hearing to order. I have a preliminary statement to make. This public hearing is to discuss proposed tobacco control regulations for the town of Shrewsbury. Copies of the proposal have been made available at the Board of Health at the Richard D. Carney Municipal Office Building, 100 Maple Avenue, Shrewsbury, Mass. 01545. The Town of Shrewsbury Board of Health is a three-member board. The purpose of the board is to promote and protect the public health for the citizens of the town of Shrewsbury. They derive their authority from the Massachusetts legislature. The members are myself, Stephen Vigent, Jenny Fishman, and Dr. George Abraham. The City of Worcester Division of Public Health is the health agent for the town of Shrewsbury, a member of the Central Massachusetts Regional Public Health Alliance. The duties of a health agent are to carry out the wishes of the board, assist in the enforcement of their regulations, and deal with the day-to-day operations of the Board of Health. It is uncommon for the Board of Health to hold public hearings on proposals before them, even though all proposals are dealt with at meetings to which the public is always invited. However, because of the broad interest in tobacco control, every effort has been made to provide a public forum for the exchange of ideas and opinions. As the purpose of the public hearing is to collect information and opinions, the board will not ask for a vote from the audience, nor will the board itself vote on the proposal at this public hearing. The board will announce the meeting date to which they will discuss and vote on the proposal. This meeting will be public. However, the board will not provide time for further public testimony unless a board member has a specific question to which an audience member can offer some clarification. After the public hearing, the board will accept written testimony for a period of 8 days until November 12th, 2022. Letters can be mailed to the Board of Health at the Richard D. Carney Municipal Office Building, 100 Maple Avenue, Shrewsbury, Mass. 01545. If the proposal is passed, the approved regulation will be posted at the Board of Health office and will be publicized in summary form in the Community Advocate with 1 week of passage. Okay, the Shrewsbury Board of Health will be conducting a public hearing to discuss the following revisions to the current tobacco regulations: a cap on the number of tobacco retailer permits, and to codify the number of suspension days for selling tobacco products to an individual under the age of 21. If anyone would like to comment on this, on these proposals, I would just ask that you first identify yourself and your affiliation. So if anybody would like to comment on the proposed, on the retailer, number of retailer permits.
I would like to,
Okay.
if possible. Good morning. My name is Cheryl Sabara. I am the Executive Director and Senior Staff Attorney for the Massachusetts Association of Health Boards. I have been working in public health law, specifically tobacco control law, for the past about 28 years. And one of the strategies, one of the more recent strategies that cities and towns have been considering and have implemented is a density strategy. And one of those density strategies, well, first of all, a density strategy is one that would reduce the availability of tobacco to youth, specifically in areas where kids are most affected, areas near schools, areas that are have been targeted by the tobacco industry. We have some research that indicates that the density of tobacco retailers near homes where youth live have been associated with youth smoking rates and the initiation of non-cigarette tobacco use. So for some of those reasons, cities and towns have looked at capping the number of permits, usually at the number they have now, sometimes one above the number they have now. And it's a long-term strategy that means that any store that exists now would continue to exist with a tobacco sales permit. However, if that permit, if that store closed and the person retired, that permit if the store gets sold, that permit would be transferred to the person that is purchasing that store. But if that store turns into a dry cleaner, if no one wants the tobacco sales permit from that store, then that permit would go back to the city or town, and I believe that's the regulation that Shrewsbury has in place right now. So it's a density strategy, it's a long-term strategy, it's a generational strategy, and it's actually a strategy that is advantageous to other retailers in the municipality, because when a permit does expire and no one purchases it, then the remaining permits become more valuable. So that's the rationale behind the capping strategy.
Okay, thank you, Cheryl.
Sure.
Would anyone else like to comment on the proposal? I should clarify that late last year, the Board of Health, at the suggestion of the Worcester Division of Public Health, decided to reduce the number of tobacco retailer permits to 20. I think it was from 27.
That's correct.
That was a number that the board felt was a reasonable thing to do. So we're doing this because of interest by other retailers in obtaining permits. But this is to determine if that's a reasonable thing to do. So are there any, Sherry, do you have any comment or?
I think there would be available another permit at the end of year if the one permit was given to 8, was allocated to 8, is it 845 Hartford Street? So I think that would, if they are not up and running, that could be given like to Market Basket in that case, or any other retailer who comes at that time.
Okay. Well, Sherry, could you just identify yourself and your affiliation?
I'm Cherry Tamri, the Prevention Specialist for Tobacco, Division of Public Health, Worcester.
Thank you, Sherry. Okay, are there any other comments that people would like to make? Anything from the board itself?
Well, it sounds as if there are going to be some shifting businesses over the next several months, so I think that we should probably be fine with the number that we currently have.
Okay. Yeah, and we'll be obviously making that formal decision at the next meeting, but I appreciate the input. If there's nobody else who wants to address the topic, I guess I can ask for a motion. Oh, no, I'm sorry. We have one other item to address. And that is to officially codify the number of suspension days for selling tobacco products to an individual under the age of 21. And this is mandated by state regulation, so this is really just a formality to adopt a state regulation that is required. I believe the number of days of suspension is 3 days for a violation of an underage sale of tobacco products.
Mm-hmm.
Okay, any other comments from the attendees?
Nope.
Okay. So I guess in that case, do I have a motion to adjourn the public hearing?
So moved.
A second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. The public hearing is now adjourned. Thank you, everyone.
Thank you.
Thank you. Have a good day.
Thank you.
Okay, I would now like to call to order the regular Board of Health meeting. The first item on the agenda is the review and approval of the minutes from the October 7th, 2022 Board of Health meeting. Do I have a motion to approve the minutes?
So moved.
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. The meeting minutes are approved. The next item on the agenda is to review and discuss proposed changes to the Shrewsbury Board of Health fee schedule and implement an effective date. And I guess the fee schedule, it's in our packet here. Has the board had a chance to review the fee schedule?
Mm-hmm.
Carrie or whoever can address it, do these fees are a reasonable amount of fee in your estimation?
Yes, and also to be in preparation for sending out renewals shortly for overnight cabins and manufactured home trailer park, and with the anticipation of permitting wells in the near future.
Okay. So just to review, we have a body art tanning facility inspection. It's an annual fee of $100. We have a body art practitioner fee of $200, a body art apprentice of $100. These are annual. And we also have a mobile home park inspection, annual inspection, $450. A rubbish hauler per company, $500. And we also have a well application with a plan review, $250. A well abandonment application for $100, and a well monitoring fee of $50. So does the board have any questions on the fees? Dr. Abraham?
Mr. Chair, two questions. Number one, are the highlighted fees, are they new?
Yes,
Okay.
yes, they are.
Okay, great, thank you. And second, the ones non-highlighted, I presume, are just carryover from prior
Currently in
fees?
place.
No
That-
changes?
That is correct.
Great, thank you, Mr. Chair.
Okay, any other comments from the board?
Are these fees pretty much consistent with our surrounding towns?
Yes, within the Alliance communities, yes, that was
Great.
absolutely taken into consideration. Thank you. Good question.
Thank you, Jenny. I took the words out of my mouth.
Mr. Chair, I'll make a motion to approve the fee schedule as proposed.
Okay,
I'll second.
okay, all in favor signify by saying aye. Aye, Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. And also, I want to add that we need to have an effective date for these fees.
We propose January 1st, beginning of the calendar year.
Actually, I need to renew the trailer park and the overnight cabins and body art for January 1st, so we will need to send out those renewals at least by mid-November. So whenever,
So we should make it
Can
effective.
we
you
make
can
it
make
immediately?
it effective immediately, or you can make it effective whenever you want, but as long as I have time for the applicants to receive their packet and review.
Would November 15th work?
Sure.
Okay? So do I have a motion for the fees to become effective November 15th?
So moved.
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. So the additional fees will become effective on November 15th, 2022.
Thank you.
Okay, the next item on the agenda is to review and discuss coronavirus COVID-19 update. And do we have anybody from Worcester who can comment on it? Or otherwise, Dr. Abraham, if you'd like to comment on current status of COVID-19.
Sure. Happy to. So COVID-19 is sort of on a plateau right now for us. And why do I say that? If we look at our wastewater surveillance, the numbers have actually gone down pretty significantly. And the number of community new infections have slowly declined a little bit. Hospitalizations are also slowly on the decline. So what does that indicate? Does that mean that COVID-19 is going away? Unfortunately, no. I think what we are seeing is a combination of the presence of natural immunity from the number of people who've had infection, as well as some degree of vaccine uptake from all the folks who've taken vaccine. Our bivalent booster vaccine uptake has been relatively slow. And so I think we're up to about 10% in the state, which is still pretty dismal compared to what our prior experience was with previous boosters. So we anticipate that in the next month or 2 months, that might bump up a little bit as that natural immunity wanes for the number of people who've had infection. We know generally between 4 and 6 weeks that immunity wanes significantly enough that they are vulnerable to reinfection. of the proportion of people that we see in hospital with COVID-19, most of them are unfortunately the elderly and immune suppressed, so the people who are most vulnerable. So suggesting that the disease still continues to be a serious threat in that demographic of the population. The presence of the bivalent booster, people have criticized whether the bivalent booster actually addresses the current COVID variants, and there is no definitive yes or no answer out there yet. Pfizer released some data based on about 900 volunteers from their vaccine, which showed that there was a significant boost in immunity with the bivalent booster, making an argument that there was value to it. And I think we would all agree that given the current situation and that the way the virus is mutating, this bivalent booster is better than nothing. And so definitely, if nothing else, blunts the severity of disease. On the variant front, there are two variants currently in play, which are subvariants of Omicron, which is called BQ1 and BQ1.1, which are significant numbers and expected to continue to increase in the US. There are other variants of interest. There's one called the XBB variant, which was described in Japan and Singapore and a lot of Asia. A few cases have been identified in Florida, not expected to be a significant player, and so we're not particularly worried. All the variants to date are all subvariants of Omicron, so not expected to be huge players. They may have some immunity escape, which means that the vaccine may not completely cover all of them, but there will be some advantages of the vaccine, which is at least blunt the severity of illness among people who get it. What is our biggest concern going into the winter? So one, the flu is going to or expected to be a bigger issue this year. We usually look at our flu experience by looking at the southern hemisphere of the world, so Australia, Chile, Argentina, countries of the world which have their winter when we have our summer. And so now this is their summer, this is our winter. And so their experience during the winter sort of tells us how severe the disease will be. And so they've had a pretty severe flu season, so we anticipate our flu season will be pretty severe this year. Combine that with no masking, close quarters during the winter months, etc. Flu naturally is an airborne illness and so will spread. So we anticipate that'll happen. So we encourage everybody to get their flu vaccine. We will continue to encourage masking and hand hygiene. So if we were to look at our experience with flu vaccine pre-2019 and our experience in 2020 and 21, clearly the masking and hand hygiene probably had almost as good, if not a more significant response in terms of blunting the flu illness. Remember, the last 2 years we had extremely low numbers of flu because I think we were isolating masking and hand hygiene. Our biggest challenge, which was relatively unexpected this season, is the presence of RSV, which is primarily a pediatric illness. However, we're seeing this in adults as well because they're either parents or grandparents of children who are ill. Unfortunately, people who have pre-existing lung disease in particular are coming into hospital with complications of RSV. So part of our hospitalizations are from RSV affecting adults. Leave alone the pediatric population, which has essentially been in hospital and has flooded pediatric hospitals and units across the country. So the trifecta, or the perfect storm, has been described for this winter, which is the confluence of COVID, flu, and RSV sort of coming to a peak around the same time, filling hospital beds, shortage of hospital personnel because they're either parents of children who are unwell or themselves unwell for one reason or the other because of occupational exposure. And so there is that fear that the season might bring some of that. So again, there is strong advocacy for encouraging our children to be masked, hand hygiene, all of us to be masked when we are in closed spaces or when we are around crowds of people, just so as to be able to keep ourselves safe as well as protect our vulnerable among us, which is our elderly and our immune suppressed.
Okay, thank you very much, Dr. Abraham.
May I ask which type of lung disorders are putting people at risk with RSV?
COPD, unfortunately, which we always see a little bit of a surge during the winter months, as you can imagine, because cold air it sets off bursting. But yes, so we've had a spate of them come into hospital with RSV, unfortunately, I think because they're either parents or grandparents of children who are unwell. So unfortunate situation, but not completely unexpected.
Mhm. Thank you.
So doctor, is RSV any more or less virulent or have more severe symptoms?
So paradoxically, it's not. It's actually a very mild virus, and most of the time, children get it and they recover completely. Most children get it. In fact, I think there's only one death reported in the last week of a child with multiple other complications who succumbed to their RSV illness. But in general, should not. And so even the rate of intubation and ICU care, etc., is generally low. So, but we just, I think, such a cluster of illness that obviously that is overwhelming, and there is going to be a proportion of people who just get more severe disease just by virtue of their other health issues, even though we generally think of children as being generally healthy, but there are children who have serious vulnerabilities, and so I think we're just seeing sheer numbers overwhelm our hospitals, which is what's really driving the equation.
Okay, thank you very much. And I think we should mention that the Worcester Division of Public Health and the town of Shrewsbury issued a statement that basically summarizes a lot of what Dr. Abraham just said in regard to what's going on with the three viruses and steps people can take to help prevent them from contracting these illnesses. So check that out if you can. I think it's on our website, right, Karen?
It is posted on the Board Health part of the website, as well as the Health Department, and it was posted on Monday, October 31st.
Okay, great, thank you. Okay, if there are no other questions, comments from the board, I'll move on to the next item, which is to review and act on the report from the Central Massachusetts Regional Public Health Alliance. And we have Micah Blondeau on the telephone today. Hello, Micah.
Hello. I don't have anything particularly outstanding. Just going to be trying to get caught up because I've missed all of this week. But if you have any questions for me, I'd be happy to answer them.
I see on your list you have under emergency, a Village Pizza and attached rental units. Do you know what the status of that is?
Yes, there were multiple issues with the Village Pizza building and the adjacent rental property. I believe, I haven't got an update this week, but he had so many things to fix that he's been shut down since we made that visit. And I believe he's working with licensed contractors to get everything back up to code.
Okay. Thank you. Any other further questions from the board? No? Okay, if that's it, then thank you, Micah. Take care.
Thank you.
The next item on the agenda is to review our meeting schedule. What is the board's pleasure in that regard? Looking at December 9th? Is it Friday?
December 2nd.
December
Or
2nd.
2nd or 9th is kind of me.
Okay, that's okay, take your time.
9th works well.
Yep, that looks fine.
So, do you have any preference to 9th? That sound good, or?
Yeah, that works.
Okay, so let's plan on the next meeting taking place on Friday, December 9th at 8 a.m.
Sure.
If there's nothing else, do I have a motion to adjourn?
So move.
I'll second.
Okay, thank you. All in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. The meeting is now adjourned. Thank you, everyone.
Cheers.